Hello, dear listeners. Today I'm going to share another case of mine. Last week, I received a phone call from a family. They told me that their 16 years old daughter was experiencing constant vomiting after being given penicillin for her chest infection. She was hospitalized because her condition was unstable and she was unable to drink or eat anything. The medical doctor were trying to give her some medication for that, but nothing was helping. I suggest them one dose of Allos 200 followed by Nux Vomica 200, and after 1 hour interval, Penicillinum 1000, just one dose. After 6 hours, her parents call me back that her vomiting and nauseous feeling stops and she is heading to her home.
In aphorism 3, Hahnemann said, the physician must know the obstructions to recovery in each case, and he must be aware how to remove them. So as a practitioner, we need to remove, or we need to able to recognize those obstructions to cure or remove those hurdles. If you don't remove those obstructions, then most of the time it is impossible to help those patients. Today, I'm going to talk about these obstructions, or you can say hurdles, in the way of healing, or another approach that I use in my practice.
Now let's return to today's topic, or the case which I just shared. Here is the point. Sometimes patient comes in a severe state. As a practitioner, we often focus too much on the symptoms without identifying the underlying cause of their condition. This is the wrong approach. That's what I did in that case. According to her symptoms, I could have given her bismuth or cadmium, which is a wonderful remedies for vomitings. But this is not the right approach. In my practice, I always try to determine the cause of the condition. So in this case, she had the aggravation after using the allopathic drug penicillinum. So that's why I gave her penicillinum instead of bismuth or any other remedies which are related to vomiting. So here we come to a very important topic, which is a use of antidote in practice. In practice, you often see that people consult a homeopath after trying numerous allopathic or homeopathic remedies. In those cases, I usually start with the antidote, like Allo 200 for allopathic drugs and Nux Vomica 200 or 1M if the patients had this previous history of trying different homeopathic remedies. I find Allo 200 is a wonderful start remedy in those cases where the patients have already taken a lot of allopathic drugs, or Nux Vomica in those cases where people has already taken a lot of homeopathic remedies. Keep in mind, always give Nux Vomica before any other remedy because it has the ability to antidote even very deep acting remedies as well. So after that, I prescribe the indicated remedy required for the case. For instance, if the indicated remedy is sulfur, first give Nux Vomica and then give sulfur, not the other way around. Nux Vomica can antidote even carcinosin, which is a very deep acting remedy. So always think of these relationships of remedies. One thing more about I want to add about Allo is that it works best in 200 potency when it comes to its antidoting quality. So keep in mind, if you do not neutralize the effects of the previous used substance, the indicated remedy may not work as effective as expected, or it may not work at all. Therefore, it is important to administer an antidote in cases where the patient has already given different kind of substance. You do not need to repeat Allo 200 or Nux Vomica again and again. Just one dose at the beginning of the prescription is more than enough. Now, I have already spoken about Allo and Nux Vomica, but there are some other remedies which are also helpful in my practice for antidoting the effect of other substance like nitric acid 30, which I use when diarrhea develops after the use of antibiotic. I use Pulstella when the patient come in after using a lot of herbal drugs. That's why I mostly give Pulstella first after someone came with the stomach issues after eating spicy or fatty food. But if you see that these people are getting regular problem after eating spicy food or something, then always think of Nux vomica, Pulstella or Bacillinum. Bacillinum has this affinity to break the recurring of this stomach issues. So if you give this Bacillinum before the Pulstella, just one dose before the Pulstella, then most of the time it stop recurring the issues related to stomach. I found Pulstella 1M works better in those cases. I also use Borax 200 when the oral or vaginal thirst developed after any treatment. Then Mesothelium is another remedy which I use in those cases where the child develop pus or white crust on their heads after any kind of immunity treatment. And then think of Pulstella sepia folliculinum in those children whose mother had excessively used contraceptive drugs in the past. Then there is another remedy which is called Diasporia kaki, which I have used or I've seen great results in few of my cases. In cases where the patient had overdosed prednisone or developed severe bone issues such as decalcification, I found that this remedy stopped the pain immediately. Even though it does not promote recalcification, I have already made a separate video of Diasporia kaki in my early videos. But remember, keep in mind in the cases of the bone issues where you see the decalcification of the bones due to age-related problem or osteoporosis, always think of parathyroidinum remedy as an intercurrent remedy. Let's say if the patients need calcarea floor for their bone issues, then give them parathyroidinum in 30 or 200 potency as an intercurrent remedy. Then I have also found a Morgan Pure 30 is a quite useful remedy for patients who have been given penicillin or other antibiotics repeatedly. I feel that bowel nosodes are very underrated group of remedies. I have already made a separate video about few of them and will share more in the future with the case studies. Dear listener, this was today's talk. Keep in mind the effect of aloes 200, Nux vomica or Pulstella. These are the wonderful remedy which we have in our Metia Medica. I always use these wonderful remedies to open up my cases. If you have any question, please do write me or WhatsApp me. See you next time with another video. Bye.